Today we're going to tackle 50 quick psychiatric facts that you should know before taking your exam. After each statement, I'll pause briefly, but feel free to pause the video if you need more time to think about it. Let's get NCLEX ready. Statement 1. Therapeutic techniques include reflecting, restating, silence, validating, clarifying, and active listening. Statement 2. Non-therapeutic techniques include false reassurance, close-ended questions, changing the topics, asking why questions, and giving advice. Statement 3. Displacement is a defense mechanism in which the feelings regarding a person, object, or situation are placed upon another person, object, or situation that is less threatening. Statement 4. Donepezil and galantamine are medications that are used for cognitive improvement in patients with Alzheimer's disease. Statement 5. First-generation antipsychotic can cause neuroleptic malignant syndrome, which can cause dyspnea, tachycardia, altered level of consciousness, seizures, dysphagia, and autonomic dysfunction. Healthcare provider should be notified as soon as possible. Statement 6. Tinnitus, slurred speech, blurred vision, nausea, and vomiting are signs and symptoms of moderate lithium toxicity. Statement 7. Selective serotonin reuptake inhibitors, SSRIs, should be taken with food to prevent dizziness. Do not take NSAIDs with SSRIs to avoid bleeding risk. Statement 8. All cases of suspected child or elder abuse must be reported to the local or state agency. Statement 9. An infant with shaken baby syndrome must be monitored for decreased level of consciousness and increased intracranial pressure. Statement 10. Atomoxetine and amphetamine are medications administered for ADHD to decrease hyperactive behavior. Statement 11. Do not take diuretics while on lithium therapy. Statement 12. Every restraint requires a written prescription by a healthcare provider and must be renewed as per policy. Statement 13. A child between the age of 2 to 5 may believe that death is reversible. Regression may occur with the child. Statement 14. Signs and symptoms of opioid withdrawal include tachycardia, diaphoresis, dilated pupils, tremors, anxiety, and irritability. Statement 15. Diazepam, lorazepam, and oxazepam are examples of benzodiazepine, which are given for alcohol withdrawal. Statement 16. Signs and symptoms of opioid intoxication include constricted pupils, bradypnea, low blood pressure, and slurred speech. Statement 17. Word salad is abnormal thought process in which incoherent speech or word are jumbled together with no meaning. An example is mouse, green, sleep, broom. Statement 18. Neologisms is an abnormal thought process in which the patient makes up words that has no meaning except to the patient. Statement 19. Safety is the priority for a patient experiencing hallucination. Statement 20. Vinegar, mouthwashes, and cough medicine should be avoided when on disulfiram therapy because it is essential to avoid alcohol and any substances that contains alcohol. Statement 21. Avoid whispering in front of a patient with paranoia due to paranoia worsening. Statement 22. The priority for a patient with Alzheimer's disease or dementia is the patient's safety. Statement 23. The nurse must prioritize establishing trust with those experiencing an eating disorder, such as bulimia nervosa or anorexia nervosa. Statement 24. Withdrawal delirium is considered a medical emergency due to potential complications such as myocardial infarction, fat emboli, or suicide. Statement 25. Pentobarbital, phenobarbital, citalopram, and sulpidem are examples of barbiturates, which are given for insomnia treatment or as a sedative for anxiety. Great job! You've just covered the first 25 psychiatric quick facts. Want to see how powerful our digital flashcards can be for your NCLEX prep? Grab your 160 free flashcards at cutynurses.com/start and experience the benefits firsthand. While you're here, don't forget to hit the red subscribe button below to stay updated with our latest insights and tips. Now, let's dive into the next 25 psychiatric quick facts. Statement 26. Echolalia is repetition of words spoken by another person. This is normally seen in a child learning to talk. Statement 27. During electroconvulsive therapy, ECT, that is performed when antidepressant medications are not effective, a mouthguard is placed to protect the tongue from being bitten. Patients must be NPO, which is nothing by mouth, after midnight or 4 hours prior to the treatment as instructed by the healthcare provider. Statement 28. Interventions for patients with obsessive-compulsive disorder includes identifying situation and environment that can elicit compulsive behavior. Statement 29. Somatic symptom disorder is diagnosed in a patient with a strong focus on physical symptoms that affect thoughts and induces anxiety. Statement 30. Monoamine oxidase inhibitor, MAOIs, are given for those with depression. It is not the first line of defense due to the potential adverse effect. Statement 31. A psychological traumatic event can cause an individual to have flashbacks and experience the event repeatedly, which is post-traumatic stress disorder. Possible causes can be natural disaster, rape, being in the army, or physical abuse. Statement 32. Phobia is an irrational fear of object, person, or situation that induces anxiety or fear. An example is hydrophobia, which is fear of water. Another example is monophobia, which is the fear of being alone. Statement 33. The nurse should stay with the patient that is experiencing an anxiety attack and provide a calm environment. Statement 34. Involuntary admission is necessary when the patient is a danger to self or others. However, the patient still has the right to informed consent and can still refuse treatment. Statement 35. While on lithium therapy, drink 6 to 8 glasses of water daily and maintain an adequate diet with salt. Statement 36. Echopraxia is movement repetition of another person. Statement 37. Milieu therapy is the type of psychotherapy that provides a safe, structured group setting for individuals to learn how to interact and use healthy therapeutic methods. Statement 38. The Health Insurance Portability and Accountability Act, HIPAA, of 1996 ensures that patients have the right to confidential medical information. Information can only be released without the patient's consent during life-threatening situations. Statement 39. Denial is the defense mechanism in which the individual ignores unpleasant thoughts or the reality of the situation to escape anxiety. Statement 40. With MAOI's administration, watch out for potential hypertensive crisis by monitoring blood pressure frequently. Statement 41. Regression is the defense mechanism in which the individual returns to an earlier development stage to avoid anxiety. Statement 42. Headaches, anxiety, mood changes, and agitation are signs and symptoms of marijuana withdrawal. Statement 43. Cirrhosis, hepatitis, pancreatitis, anemia, and brain damage are potential complications of chronic alcohol abuse. Statement 44. CAGE screening questionnaire is the screening tool used for drug and alcohol use. Statement 45. When taking tricyclic antidepressant, TCAs, watch out for anticholinergic effects, urinary retention, tachycardia, and seizures. Statement 46. Slurred speech, drowsiness, and hypotension are signs and symptoms of CNS depressant intoxication. Statement 47. Signs of alcohol withdrawal peak after 24 to 48 hours and must be treated to prevent life-threatening symptoms. Statement 48. Excessive spending, restlessness, flight of ideas, and grandiose delusions are examples of mania. Statement 49. Lack of energy, suicidal thinking, poor concentration, inability to make decisions, and low self-esteem are examples of depression. Statement 50. Barbiturates should be taken 30 minutes before bedtime for someone with insomnia. Fantastic work on mastering all 50 quick psychiatric facts. Make sure you're confident with these before taking your next psychiatric exams or the NCLEX. Eager for more tips and tricks to enhance your nursing school experience? Tune in to my next video where we explore essential nursing school hacks to keep your journey exciting and engaging. Thanks for dropping in and see you in the next video.